Welcome to the Health GIS interface, which is part of our Community GIS project. The platform intends to gather real-time information from various stakeholders of health service providers and community across the geography or cities. The information is provided by various health management staffs of respective health centers, and users from the community or city administration can view and take decisions accordingly. Let's take a tour and understand more. Health GIS interface is part of Community GIS, designed by community for community. One can view information right from national level till pin code level granularity. The key driver of the project is facilitating communication between citizens and service providers. The entire project is empowered by Census 2011 dataset, Maharashtra Arogya data, and data collected through voluntary participation by citizens through embedded Kobo Collect form. When a user opens the page, one can be volunteer by clicking on the volunteer tab on the top. This action takes user to a Kobo form where various information regarding the health facility can be provided. This information feeds into developing data repository and further visualization through maps. The main page has two basic divisions. On left hand side, a user can set filters for visualization, while this action aids in navigation on the map on right hand side. One can navigate from national to state to district till pin code level. One can also set boundaries for states and districts to demarcate their visualization. Next, the filter All India View produces mapping at national level, and by selecting type of health facility, one can geographically locate the center. These geopoints, when clicked, provide specific details about the health facility. One can also provide feedback or correct information by clicking on the tab provided on the top of the dialog box for feedback and correction. It further navigates to feedback Health Community GIS form. One can also include screenshot of errors. Next, move to Navigated Area View, where users can explore hierarchically from state to pin code level granularity. Let's select Maharashtra, then Mumbai city, and by selecting pin code, one can zoom further. At all these levels, different types of maps are available as shown on the left side panel, like demography, road networks, schools, etc. We have included schools because schools have been converted into isolation centers during the COVID pandemic. Road maps can be used for route optimization. Further, one can explore the healthcare facilities, both government and privately owned. We have public health centers, allopathic centers from Census 2011. Then we can also plot dedicated COVID facilities as per Arogya Maharashtra data, which are dedicated hospitals, health centers and COVID centers. One can spot these bubbles which correspond to total number of beds, and with just a click, one can view specific details like ventilator beds, total number of beds, etc. Further, moving at pin code level, we have town boundaries and village boundaries to demarcate the area for proper analysis. The most fascinating part is the location-based visualization, wherein a user can set a radius, say 8 to 10 kilometers, and locate all the health centers falling in this range. This empowers citizens in making timely decisions during the emergency situations. Check the beds available in the golden hour of the patient and provide appropriate health care. Now, what's the big picture? This could be visualized for Anganwadi centers, nutrition rehabilitation centers, round-the-clock care facilities, etc. The code is scalable to empower all stakeholders in appropriate and smart decision making. Health GIS, empowering you.